Hello everyone, Paul Martin here. It is February 25th, 2020. The CDC today came out with some guidance that, quite frankly, alarmed a number of people. They have changed their guidance significantly over the last week after the press release came out from the CDC stating that coronavirus will likely come to America and will likely cause disruptions. This changes the response that people may want to have. I've gotten a lot of text, a lot of messages, a lot of emails, a lot of calls just this afternoon and tonight asking me what to do. I said I posted a video on Sunday. Apparently that video is too long, so I am condensing this down. We're going to get through this hopefully in under 5 minutes. This is my absolute hurry up, what do you need to know message. First and foremost, continue to monitor COVID19ready.com. That is where I'm posting all the information I can find. I will update it as I can. COVID19ready.com. There are 3 takeaways today from the CDC's release on their website. The next three slides I have copied from the CDC's website verbatim. More cases are likely to be identified in the coming days, including more cases in the United States. It's also likely that person-to-person spread will continue to occur, including in the United States. Widespread transmission of COVID-19 in the United States would translate into large numbers of people needing medical care at the same time. If you have been reading my website and what I've been posting, you will know that we have been talking about this for some time now. Schools, child care centers, workplaces, and other places of mass gatherings may experience more absenteeism. Remember, we've talked about this before. When places close, that creates a lot of problems for child care. It creates a lot of problems because paychecks aren't earned. These are things you need to be thinking about. Public health and healthcare systems may become overloaded and elevated rates of hospitalizations and deaths. Other critical infrastructure, such as law enforcement, emergency medical services, and transportation industry, may be affected. Remember, we've talked about this. We've talked about the fact that emergency medical response time, fire department response time, police response time, all these things may be adversely affected if there is a widespread outbreak of coronavirus in your neighborhood. Healthcare providers and hospitals may be overwhelmed. At this time, there is no vaccine to protect against COVID-19 and no medications approved to treat it. Non-pharmaceutical interventions would be the most important response strategy. Folks, the last 3 slides, we have been talking about this for 2 weeks now. I'm not saying to tell you this, that I'm saying I told you so. I'm sharing this with you because pandemic response is predictable, and because it is predictable, we can create highly accurate response plans personally, on a personal level, to deal with it. All right, here's what you're going to need. I'm not going to read all these things. You know what you need. Most of this stuff is self-explanatory. I'm going to talk about the N95 mask here in a moment. The over-the-counter pain relievers and fever reducers, you need to visit with your healthcare provider before you take these, especially for children under the age of 4. Children under the age of 18 should not receive aspirin. By the way, this is all CDC guidance. This is not my guidance. The idea of having these medications, the acetaminophen, the ibuprofen, the naproxen, the children's Tylenol, Motrin, the Sudafed or Mucinex, Imodium, all these things are to have on hand so that when you get sick and you talk to your doctor, you can say, this is what I have at my house. What should I take? This is how much of it I have. Given that, what should I take? You want to put yourself in a position to have these medications on hand so that you can deal with the problem. Bleach. If you don't have bleach wipes of some sort, you're going to be decontaminating lots of common area surfaces. Go online, figure out the proper ratio of water and bleach to make a disinfectant. There are plenty of examples online. Just Google that. Depending on your situation, you may have to make it stronger or weaker depending on what's going on at your house. Buy cheap generic bleach, unscented, 6% formula, 6% solution. That's good enough. Laundry detergent, you're going to be washing a lot of clothes, a lot of bed sheets. Have some of that available. Cash on hand. If there is a run on banks or run on ATMs because the banks are closed, ATMs may not have money. You want to go ahead and have some cash on hand just in case. Here are what you need to do. I'll have some links below when you scroll down to some of this, the World Health Organization guidance as well as the CDC guidance. Check with your medical professionals on what over-the-counter meds they recommend. Designate the sick room. Where are you going to put your sick patient or patients in your house? Clarify with your employer your work arrangements. Are you going to get paid? Can you work from home? What's the sick leave policy? Make sure you have an understanding of that. Make sure that you top off the gasoline in your vehicles. Again, these things tend to cause second and third order disruptions. If there is a major outbreak in your community, it may be that there's some disruptions in getting gasoline supplies to the local gas stations. In addition, if you're on a propane tank, you want to get that topped off as well. I mentioned masks. These are two N95 masks. Don't panic if you can't find them. There are some for sale. I just checked on eBay. They're very expensive. I highly recommend that you have a few on hand, but if you don't, you can't afford it, you can't find it, don't sweat it. It is not the end of the world if you cannot get an N95 mask. But I want to show you two different pictures because these masks do two different things. These are both N95 masks. The one on the left, notice it doesn't have the valve like the one on the right here does. The one on the left is designed to be worn by the patient to keep them from expelling the cooties out of their mouth and out of their lungs into the air. So if you have a patient in your house, have them wear one of these masks when you are around them, taking care of them, so that they are not expelling their disease, their germs to others. The one on the right, this is what the healthy person wears. This little valve here in the red circle, this allows air to get out. The mask on the right is more comfortable to wear. Now, if you only have your choice, you can only buy one mask, buy the one on the left, buy the patient version. Healthy people can wear this mask as well, but it's just a little more uncomfortable for healthy people to wear it because it doesn't have the valve. So if you have to choose between the two, get the one on the left. Other things you need to do: get your prescriptions filled, increase your water. I like Immersion C. I find it is helpful, but find some other supplement that helps boost your immune system. It's not going to hurt. Monitor social media platforms of local public health officials. Find out what your local EMS, your local county health department, what are they saying about the situation in your area. Plan to decontaminate common surfaces in your home with Clorox wipes or bleach solution. We talked about that earlier. The idea is so that you don't transmit the disease to others in your household. Professional guidance. First and foremost, do what your medical professional says. I'll link to a couple things below. CDC's the flu, caring for someone sick at home, as well as a document published by the World Health Organization, how to care for patients at home with coronavirus. These two good documents are really good to have on hand. I've printed off the WHO document, the World Health Organization document. It's a little more detailed. I've actually printed that off and I keep it in my medical supplies so that it's handy and ready to go. Why are we doing this? Back to slide number 3, the third of 3 takeaways. Healthcare providers are going to be overwhelmed. There is no pharmaceutical intervention. There is no medicine to give you. Most of this is going to be at-home care for all but the most severe cases. So put yourself in a position to have the supplies ready so that if you have to take care of someone in your house, you can do it. That's all I have. I hope this has been helpful to you. If someone's asking you, oh my gosh, what do I do? Feel free to show them this video. Hopefully they'll get something out of it. I'm Paul Martin. Thanks for watching. God bless America.